I think that it's important in modern women's healthcare to really understand the reproductive life cycle of women. A reproductive checkup is now commonly done on women in her 30s, in which we take a thorough history and physical, we do a transvaginal ultrasound to assess a follicle count, and we check basic biomarkers like FSH levels and especially AMH levels. By looking carefully at a woman's history, by analyzing her ovaries, and by checking the biomarkers, we could figure out whether a woman has good or impaired reproductive potential. Ultimately, egg freezing has gone from science fiction to a reality, and the science is finally equaling the hype. More than 10,000 babies have been born from frozen eggs, though the majority of the babies born have been born when the eggs were frozen before the woman turned 40. Ultimately, new genomic screening technologies of embryos are allowing us to identify the healthy egg even amidst many. In today's annual examination of a young reproductive age woman, I think it's important to ask the questions about ultimately what family planning looked like to her. If family planning includes having 1, 2, or more babies, and a woman is in her 30s, then I think egg freezing is really a reasonable technology. And in fact, if a woman's in a committed relationship, then embryo freezing, and especially freezing of screened embryos, can give the woman a very high degree of likelihood of reaching her reproductive goals. I believe that an annual visit for a reproductive age woman should include a conversation about reproductive options and family building. Ultimately, some basic questions, an ultrasound, and some blood tests can help us establish a prognosis and then allow us to create the right options for each patient.